Oncology, patient's own prescription pre-treatment medication workflow. I'm currently logged in as an ambulatory oncology nurse. I've completed my pre-chemotherapy checks and decided that the patient is ready to proceed with treatment today. I have activated the treatment, which places the medication on the MAR. If I go to my menu and from the table of contents select the MAR, the best view to look at power plans under is the plan view. By selecting plan view, this places the medication in a chronological order on the MAR so that I can see what needs to be given first. It's also reverse chronological, which is new for nursing, but the current time and date is highlighted in yellow. We can see here the first two medications are ondansetron and dexamethasone, which are pre-medications in order to proceed with treatment. Now the question I would ask is, did the patient bring their own pre-medication prescriptions? In this instance, we're going to say the patient has their own medication and they've taken them. In order to reflect this, I would select the medication administration wizard and scan the patient's wristband. Once I scan the wristband, I can see which medications are due for the patient next. Now I want to give the dexamethasone and ondansetron or reflect that the patient's given them. You can see that there's the mortar and pestle beside these medications, meaning that pharmacy has not verified them. I would select my dexamethasone dose, which is letting me know that it has not yet been verified. This will pop up in these instances as pharmacy is obviously not verifying prescriptions that are filled at an outside pharmacy. So I would select yes to continue. Now I'm going to do the same for the ondansetron. Within this window, the results column has a down arrow, which I would select. Now in the charting window that pops up, the performed by task is showing the user's name, which would be my own. Since the patient has taken their own medication, I would simply type self-administered in this box. I would then say OK, and I would do the same for the ondansetron dose. So instead of having my own username, simply typing self populates the box with self-administered. Once I'm satisfied with these medications that I am signing off on, I would click sign in this window. This shows that they are both complete on the MAR, and when the MAR is refreshed, it shows what time they were given, and if I went in, it would reflect that these medications were self-administered. Now, if the patient did not bring their own prescription, you would follow your local policy procedure to go to the Omnicell and collect this medication, and then from there you'd be following the closed loop barcode administration medication for these pre-medications. This concludes the workflow for patient's own prescription pre-treatment medication.